Oh, yeah.
No, it's 2.5. 2.5.
Right, so you said.
No, because it's half of 5. So half of 5 is 2.5. Times 2.
So you're giving us one of those little. Yeah. Work it away. Or actually, I'll wait for it.
Is it wrong?
30 milliliters, that's how many.
Yeah,
Alright, so you're thinking of this way, you're gonna get one of water. And take some of the 6 day, how long does that go? That's basically what that is, so this is your overall amount.
I was like, oh, what did he do?
I think the recording is in reverse.
5 ml plus 2.5 is 7.5. And it'll be times it by 2. Which would be 15.
Let me do this way.
There's a fry first, and then I do it. But it's definitely 0.5 plus 2.5.
So it's 13 days, yeah.
So when you add it, it's 7.
There you go.
What's the top of times it by 2? And that would be 15. And then you divide 1 time.
Oh, they got your face. Oh, yeah.
There you go. Ready? Okay, let's do answer. What's your final unit?
Days.
Days, not months. Okay. Number 1 is 10 days, we did it on the board. Number 2 is 5 days, we did it on the board. Number 3, Rennie.
3 days.
3 days, correct. Who got 3 days? Hands up. Good job. Number 4, Zithromax, prescription number 4. We're going down, okay? Zithromax, 250, dispense 14. Oh, I forgot to mention this. 2 stat is taken immediately, okay? So that's your day 1. And then 1 QD, 1 every day. Rennie, can you guess the answer to day supply for this one?
6 days.
Okay, so 2 stat, then 1 QD. What you do here is 14, right? You have to give 14. 1 every day without looking at the 2 stat, right? So 1 every day is 14 days, but you have to give an extra on day 1. So a shortcut would be for Zithromax or azithromycin, -1. Okay? Why? So dispense 14. But the first day, your day 1 is 2 stat. You follow? Which means you're going to have to take away 2 here. And you're left with 12. But you only have to take 1 every day. So this is 12 days. Are you following? Plus your day 1. Total is 13 days. So what's the shortcut for azithromycin, Zithromax prescriptions for day supply? If you see the total quantity and then 2 stat and 1 QD, just take out 1. Okay, because you have to double up the first day. Did you understand that explanation? Day 1 is 2 tablets. So take that away. You got 12 remaining. You have to take 1 each day. So that's 12 days plus your day 1. 13 days. Who got 13 days for this one? Hands up. Okay. Next one, Premarin prescription. 30 days. We did it on the board because it's 1 month. Okay. Augmentin. Aaron, Augmentin.
45 days.
45 days. Who got 45 days? Hands up. Okay. Kozar, Maria. 105 days. Correct. Yasmin. Jessica.
28
28
days.
days. Who got 28 days? Okay. 105. You said 105, right?
Yes.
Okay. That's okay. Motrin. Take note. Fun fact. Motrin, 200 milligrams. Generic ibuprofen. is over the counter. 400, 600, and 800 milligrams are prescription. Okay? But nobody's stopping you from getting it over the counter and taking as much. But remember, what's the number one side effect of Motrin, aka ibuprofen, which is an NSAID? Thank you. Gastric irritation or bleeding. Very good. It always shows up on the board exam. And I'm like a broken record, so you should get that correct on the PTCE. Okay? Motrin, how many again? 50 days, correct. Sam, methotrexate?
60 days.
60 days, correct. You can do the shortcut, larger day number, 15, minus smaller day number, 10, plus 1.
Oh, so she had the same answer.
60 days, why?
Because of the 3 times.
2 times 3 is 6. And you have to take it 15 minus 10 is 5 plus 1, 6. Shortcut. Okay? So what is that? 72, right? Divided by, how much is that? How many is that? 2. Times 30 days, because there's always 30 days in a month. So the answer is 60 days. Who got 60 days?
Yeah.
Sam.
Yes, because.
Sam told me it was done.
How come she got the correct answer and you said Sam?
Because we had the same answer. And she just did my work. You didn't update me.
Whoa! Never trust anybody in the pharmacy, especially. Lesson learned today. Yeah. Okay. Endoset dispense 21 Q6 to 8H. Day supply? Everyone. 5 days. Adderall XR 20 milligrams. Josh? 50 days. 50. Randy, you okay? You're having it. You like this? You got a headache today. I thought you got a headache today. Okay. Furosemide. Ashlyn? 25 days. Who got 25 days? Ashley, FX or XR? 32 what? 32 days. Who got 32 days? I'm going to call Ashley extra because we're going to miss her the next 2 days. Amoxil dispense. She gone. Monday and Tuesday. She's like, sorry guys, gonna be in Mexico on a vacation already by the beach. Hasta la vista, baby. Oh man, I'm jealous. This is me sounding jealous. Okay, next one. Amoxil 150 milligrams per 5 ml, 6 days. Who got 6 days? We did it on the board, so you should get it, right? Next one. Lortab elixir. How many days? Let's test Rennie again. Okay. So what do? Convert 1 to 2 teaspoons. Which one is larger? 2. Make that an ml. 10 ml, right? Every 4 to 8 hours as needed. Every 4 is 6 times a day. Every 8 is 3 times a day. So encircle the 6. Multiply that by 10. So that's your 60. Now we have apples to apples, ml to ml. 150 ml divided by 60 ml should give you 2.5. What's the rule in day supply? Round down. So what's your final answer? 2 days, correct. Sometimes we just need a couple more extra samples. Okay? Zithromax, let's do this. Yummy?
20 days?
20 days. Who got 20 days? Hands up. Are we there? What are we doing? Why is like nobody raising their hands except for this side? Okay. Are you with me? Yeah. So Kathy doesn't say she didn't call me today. Kathy, you're next. Megestrol suspension.
40 days.
40 days. Who got 40 days? Hands up. Okay. My sensitive ones. Miss L skipped me today. Ty, your turn. Lactulose.
I'm not sensitive.
No, I'm just-
all day.
No, No, I'm teasing Kathy because there was a day she said, Miss L.
You didn't call.
You did call me. Okay. I know you. You're not sensitive. Lactulose. Oh, 12 days, correct. Who got 12 days? Okay. Next one, Finnegan with codeine. Where did Justin go?
I could answer for you.
No. Erin. Yeah.
6 days.
6 days. Who got 6 days? Steve. Hycodan syrup.
Which one is it?
Bottom. Second page at the back.
7 days.
7 days. Who got 7 days? Amoxil on the right side. Going down. Many.
15 days.
15 days, correct. Hurry up, Calvin, you're next. Zyrtec syrup, right side, back page.
56 days.
56 days. Good job. Who got 56 days? Justin, you're next. Going down, chlorhexidine.
32 days.
32 days. Who got 32 days? Okay, Ashley, back to you. You want to do this? I'm going to do it so you don't miss anything. Tasha next. 8 days, correct. Who got 8 days? Josh, back to you. Tegretol suspension. 16 days. Ah, so many bees around me. So many. Okay, so many. Pay attention, okay? If you don't want me to write on your quiz, I told you to pay attention during class. Okay? Doxepin, next one. Yummy.
36
36 what?
days.
36 days. Correct. Who got 36 days? And everybody, Tessie Organodin.
10 days.
10 days. I'm that selfish girlfriend. Pay attention to me. Only for 4 hours. Okay? Breathe 2 minutes. Next topic. Get one and pass. Please stop those murmuring because other people are getting distracted too. If I can hear it all the way here and I'm getting distracted, the people around you are getting distracted for sure.
Homework?
You know why I said I'm going to put that on your test paper? Because if you fail, I'm going to tell you, I told you so. Pay attention to me. You don't want to see that on your paper. Okay.
Rainy. She's not picking on you. You're her favorite because you're a freshman.
I forgot to tell that during orientation. I do favorites. You will notice. Who do I call all the time?
Seniors and
Seniors and freshmen. Multiple times.
And vacationers.
Vacationers. Because I'm jealous. She's leaving us going to the beach while we're freezing out here in Vegas. Right?
Anyway.
I know the beach is calling me already, but we can't. I know. Can you take us in your suitcase?
I told her I already got the first spot. I've been telling her since you told me.
Yeah.
Have me in a suitcase. I won't breathe. I won't move till we get to Mexico.
Okay. It's gonna be like sipping pina colada and mojitos by the beach. It's like not gonna think of us for 2 weeks. Okay, next topic. Quantity to dispense, quantity to be dispensed. Doesn't matter, but most of the time you'll see this topic as dosage calculations. If you're finding a topic or a reference, it's dosage calculations. Okay. In other words, how much do we have to give to the patient based on this prescription? Okay. And if you noticed, the practice problem I gave you is 3 pages. And there's a reason to that. Okay. Because there's 3 subtopics, and you better pay attention. This is the quiz that most students fail. Why? A simple reason of not reading the directions. Sometimes the question is, how much do you have to give per dose? Sometimes it says per day. Sometimes it says total quantity. So you have to pay attention to that. And on the PTCE, it will be scattered everywhere. It will ask you sometimes per dose, sometimes per day, sometimes total quantity, okay? I'd like you to know this terminology in case they change the wording. Per dose is the same as single dose. Is the same as per administration. In other words, per pop. How many do you have to every time you put it in your mouth? How many or how much? In tablets or capsules, and in liquid form in ml. Is that clear? That's our first page. You following? Okay, so let's do the first one on the first page. Order.
Order amoxicillin 500 milligrams.
She's like,
BID.
listo. Amoxicillin 500 milligrams. Very good. I like that.
BID.
BID
10
times
days.
10 days. Supply?
Amoxicillin 200 milligrams tablets.
So 200? Okay. Usually amoxicillin comes in capsule. But for the purposes of calculation, we'll follow this prescription. Okay. Here's a problem, which is a good problem to have. Okay. Sometimes we don't have the same exact strength, okay, available to us in the pharmacy. But it doesn't mean that we cannot fill that prescription. It has to be the same exact generic though, okay? The problem here is your supply, which is in tablet form, is 200 milligrams. But the doctor wanted 500 milligrams. You might want to put on your worksheet quantity to dispense on top. I'll talk about the formula in a little bit, right? So that is a problem. Know that tablets can be cut. Okay. What do you call tablets that has this line at the middle? Scored. That shows up on the PTCE as well. It allows you to cut the tablets. Okay. We do have pill cutters. Okay. Pharmaceutical companies give it for free, or now you buy it from pharmacies next to your pharmacy, like the ones that they sell here on the side. Scored. Okay. The smallest that you should cut a tablet is a quarter. Anything smaller than this, the tablet is going to get crushed. Okay. So for calculations like this, we're going to have to assume that these tablets are scored. Is that clear? Okay. On your test paper worksheet, you have a formula that says D over H times Q. When I was in pharmacy school, this formula didn't exist, so my guess is it was a pharmacy technician who created this to simplify it. Okay, but it's not foolproof. Okay, that's why, listen to me carefully. Use this formula for tablets and capsules only. It doesn't work. It doesn't click in the brain for liquid. Ratio and proportion will click better, and I'll tell you later how and why. First, let's talk about this. D stands for desired. What did a doctor desire for the patient? Which means prescription, 500 mg. But what do you have in your pharmacy? 200 milligrams. Since this is a per dose question or single dose question, it's going to be 1 all the time, right? Once you see that the question or the instruction says per dose, does the BID matter? No, because BID stands for 2 times a day. Why do you need it? It's a per dose. Does the 10 days matter? No. So you proceed. Are you following, Randy? This means 2 times a day. You know, you only need, you're on first page, so the instruction says per dose. You don't need the per day, you don't need the total. So the first thing you do once you see it, cross out the BID, the TID, the QID, okay? And then cross out the total number of days. Then we proceed. How do you proceed? 500 over 200 times 1 is? What is it? Give me exact answer. 2.5. What is this? Tabs, right? 2.5 tabs. Now, for quantity to be dispensed, day supply is round down. Quantity to be dispensed is? Round up. So if I see 2.5 tablets, well, how much do I give to the patient? 3 tabs. Okay. However, if you're in an institution, okay, in a single dose, and the tablet is scored, you just give the 2 and then cut the tablet in half, 2.5. Is that clear? But if this is like purposes of calculation test, then you follow that rule. But yes, we can give 2.5 tablets. Okay, 2 tablets and a half. Why? The prescription is 500. For you to make 500, you need 2 whole tablets of 200 and half of that. Get it? Okay. Clear? Okay. Flip the page to the second page. Is the prescription exactly the same? I don't think so. This is a 250. So pay attention how it's not always the same per page. Okay. 250 BID. This one's 20 days in the prescription. And then this one's 250. But before we start, let's talk about this. So the second page, what's the instruction?
Single
Single day, which means per day is the same as single day. So this time, the BID, the TID, the QID matters. So I'm gonna have to leave that here. But does the 20 days matter?
No.
No. You see how I use colors differently? Okay. No, because it's not important. So what do? We do the same thing. What did the doctor desire for the patient? 500. What do you have? 250. And it's always 1. So what is this? 2 tabs. Does it end here?
No.
Because we're on the per day part now, right? So you said this matters. So what do you do there? Times 2. So the answer is 4 tabs. Clear? Claro? Okay. Next one. Last page. Put total volume / total quantity because they're not all liquid form. Okay? So if it's not specified, I'll accept tablets or capsules. But if it says in there capsules, you gotta give capsules. On this page, you have to calculate the total quantity. Okay? How much do you have to give to the patient for the entire duration of treatment? Which means the BID matters. For how long matters, because the entire duration. Okay, now let's rewind. For this one, picture this as the patient is in a nursing home, assisted living, hospital. Every time the nurse or the caregiver has to give the patient something per dose, right? Or at home, right? The per day, okay, if you're doing a per day, you're working in a closed door facility, you remember the blister packs? That's what you're gonna do, the per day thing, right? And the total quantity is picture retail. You're gonna have to put them in prescription bottles for the 30 months that they need it, 30 days that they need it, 60 days, 90 days, or whatever it is. Is that clear? Okay. So pay attention to the directions. Okay. Next one, let's double check if our prescription is still correct. No, this is a TID. And this is a 15 days. Everything matters now, right?
Capsules.
And this is in caps. Thank you. So this is 2 caps, correct? Didn't change. But this one is times and times total. We're at total now. So what is this? 6 times 15 is 90. Unit? Because it says capsules, it has to be capsules. Is that clear? Okay. There are some irregular prescriptions in here. What do I mean by that? First page. What's the irregular prescription? TID to QID. Okay? Well, for the first page, it doesn't matter, right? Because it's a per dose. For the second page, it matters. Number 18. Why does it matter? Per day. Okay? So which one are you going to pick for the TID versus QID? The QID. Always pick the max because we don't want to short the patient. Okay? I will do number 18 just for an example, for example purposes. Okay? And it's in liquid form too. I'll show you how it's easier ratio and proportion to do this, okay, than desired over half times quantity. Why? So here's the order. I'm on prescription 18. Albuterol, 3.5 mg, TID to QID times 34 days. Okay? What do you have for your supply? Albuterol, 2 milligrams per 5 ml syrup. You seeing this? Why this formula won't work? It's because this is in fraction form already. You have to give every teaspoon, what the patient is taking is 2 milligrams of active albuterol. You following? That's how you picture it, okay? Because this is in fraction, it just makes it easier for you guys to set it up ratio and proportion. 2 milligram per 5 ml, right? For a single dose, I will use 3.5 mg is to x ml. This is my per dose answer for now, because I have to do that before I could move forward. And what's my x? 5 times 3.5 divided by 2 is?
8.75.
What is it?
8.75.
I trust you guys. 75 ml. That's per dose. If I were you, I'm going to put per dose. Okay? Per dose. Now I have this per dose. We're not on the per dose page. We're on the per day page. What is this? 3 times. And this one? 4 times. Now's the time to cancel this. Which one's larger? 4. Can you pick that up? This is my per day. Right? How much would this be? Now I'm on the per day answer.
35.
35 ml. Correct. Correct. Unit for ml, lowercase m, capital L, because capital L is liter. But if you write ml, that's fine for me. Yeah. That's it for that page. That's the correct answer. However, if we want to move on, then we'll have to include this. Now, our total will be, what do? You multiply it by 34. And what's the answer? What is it? 190 ml. Is that clear? You know, this is a little bit of a different math for you because it's pharmacy math, dosage calculation specific. But if you have a good foundation, you'll be fine after practice and practice and practice. That's why every topic I have a homework for more practice. And not to forget, you also have your books. Okay? Why do I have extra worksheets? Because your books are with you all the time. Yeah? You can just browse it, look for it, attend tutoring, bring me a problem. I mean, I hate that, but I mean, bring a problem from the book that you want me to solve because you couldn't get it. That's how tutoring works. And we'll work it together. Okay? But I'll give you every single worksheet that I have created through the years. Okay? Here's homework for the ones who are fast and want to work. Remember, your final exam, nor the PTCE or ExCPT, will not be grouped as to per dose, per day, total quantity. So pay attention to those questions or instructions. Is that clear?
Yeah.
That's how many students fail this particular quiz, topic day supply and quantity to be dispensed, because they did a total when the instructions specifically said how much per day or how much per dose. Don't tell me I didn't warn you. Okay? I hope by Monday we have a board, or like what Tisha said, she's gonna go ballistic by Tuesday. Because I'm lecturing on Tuesday. We're gonna have food on Tuesday. Are we gonna have food on Tuesday? It's our last day at the campus. At the campus. For our, because not everybody's coming to the lunch on Monday. So it's up to you guys. You know, Miss J and I are just like, yes, let's do it. What are we gonna bring? You organize it, okay? I'm done with my coffee. I'm done today. We still have pharmacology. How do